Okay, this tooth exhibits a couple of things I like to talk about when we're looking for orifices. One is the wonderful use of the microscope in helping us find canal anatomy. And I have a 5-step microscope here, and my macro lens right now is at 0.5, and I'm looking down into the tooth here, and I'm going, look, this is nice, but you know, I'm a 63-year-old guy. I want to see a little bit closer, so I'm going to bump this up here. See, the light always changes, and the view always needs a little bit of fine focusing, and there we're getting a better view down into the chamber. It shakes around a lot, and you find your comfort level with it. But if you're going to be doing a lot of endodontics, and we're talking about orifice exploration, you really want to think about getting yourself into a microscope. It doesn't need to be a super high-end microscope. It might even be a used microscope, or you might have the economics to go out and just buy a really nice new one, which would be way cool. But anyways, so now we're up to 0.66, and the second thing that I want to show you here is that one of the obvious tricks in finding orifices is a bleeding point. And you can see a bleeding point quite nicely here. And again, I'm trying to focus and look all at the same time, but there's our bleeding point. And we know with a lot of confidence that there is going to be a canal right there. So a bleeding point helps orient you as to where the canal is exiting into the chamber. And now we're at 0.6, and now again, so the bleeding point is a trick in finding canal anatomy, but also a microscope. Now look at how this thing starts to change. I'm going to adjust this again, because as you change, look at now the view we're starting to get of the chamber. And the layout, the anatomy. We can kind of start to see some more anatomy here. Boom. A stick like that is a very good sign that we have ourselves a canal right in there. And the width of the chamber and the distal makes us think that we probably, there it is, pretty much locked in, probably have ourselves 2 canals in this distal area here. And again, a stick like that is another very good probability that we got 4 canals right there. And we are at the 1 number, and now we are going to go to 2. Now what I find with this particular microscope is that when we go to 2, the light seems to change, but there we have a good idea as to what the floor of the chamber looks like. And there's still a little bit of tissue there clinging to the floor of the chamber. This was a fairly vital case with an exposure on the distal due to caries. I often will work in the 1.5 range, which is right here. The color still stays good, and I can see I save, shall I say, I do most of my orifice and canal exploration at this magnification. And again, I just want to reiterate that if you're going to be doing a lot of endodontics, a microscope makes things unbelievably more visible. It takes the stress and strain away from your days. It does take some practice. And again, so does having a very good patient like we have here in the chair. So there you go, guys. Think about a microscope.